name is Elizabeth Garrison, and I'm a speech pathologist here at Prisma Health Children's Hospital Midlands. And I work in our children's hospital in our neonatal ICU, working with infants and children on feeding and swallowing and communication. So I was at an event with some friends, and we had been there for the majority of the evening. And all of a sudden my vision became really blurry. All I knew to say was I was really dizzy, and I just got immediately dizzy. And a friend I was sitting next to thought maybe I was having some sort of an allergic reaction, so I tried to drink a little bit of water, and then she noticed that my face was drooping. And so she kind of became pretty concerned pretty quickly, and by that time I couldn't move my arms and legs. So they helped me up out of the room that we were in and brought me to the hospital. I do remember arriving at Richland and then being assessed, getting neuro checks, and I can remember them asking me to let them know if I felt something on my leg or if I could turn my head or do certain things. And it wasn't that I couldn't do it, it was just that there was no feeling. I didn't feel it. I knew that they were asking me and I couldn't feel it. It was overwhelming. It was unreal to think, how can I have a stroke when I'm a young, relatively healthy girl? Like, you never think it would happen to you. And there they took me back for a CT of my head, and when they saw there wasn't a bleed, they started TPA. So TPA is a drug that will burst clots that may have caused the stroke. While I was here, they worked me up to figure out why I had this stroke and what I could do to make sure I don't have additional strokes in the future. And during that workup, they found that I have a small hole in my heart called a PFO. And that PFO kind of caused the blood clot to go from crossover in my heart and shoot up to my brain. I'm gonna follow up with cardiology about having that small hole repaired. It was comforting to be here at Prisma Health, and I think I knew the moment I got here, it was like a sense of relief that I knew they were gonna take care of me. The nurses and doctors were outstanding. And so they brought me the evidence to support what they were doing and why they were doing it, which was wonderful. I so appreciated that. And everyone down to the transporters who got me quickly from the emergency department into the CT scanner so they could see it wasn't a bleed. I'm grateful to them. I'm so grateful to the rehab specialists who came by and evaluated me. I failed my nursing swallow screen, and speech had to come see me to give me a diet to let me eat and drink, and I am speech, so it was quite a full circle. I'm grateful to PTs and OTs who came by and evaluated me and gave me exercises and tips and tricks to help regain my mobility and my strength and stuff. So it was a whole team, and I'm forever grateful to everybody here at Prisma Health and the care that I received. It was comforting. I knew I was at the Comprehensive Stroke Center, the only one in the Midlands, and so I knew the moment that it seemed like a stroke and I got the TPA, I was so confident that I was where I needed to be and receiving the help that I needed.